plantar fasciitis, we've had certainly one client who came in for, I think she had 6 sessions. After about 3, she hadn't felt much, and I said, "Look, trust me." And actually by 6, the pain was gone, and there was a little bit of pain in the ankle, and then she worked with the physio to basically work it out from the ankle. So we're very, the bed cannot change somebody structurally, they cannot change their posture, they cannot, but what it can do for people is reduce the pain enough so they can see their physio or someone like yourself and actually work through that structure, and actually work, come out from it much better than you were before perhaps the injury.
It's good to know I'm not going to make myself redundant anytime soon.
No, always have to refer. Because we see it ourselves. We use people because we know that we can get rid of the pain. That's the thing that's driving the client, is generally bringing them down. But we know that necessarily they might need to go and do some structural work. But we've had somebody else with a knee who was due to have a knee replacement, and now the consultant is discussing not having a knee replacement, which is amazing. So they need to strengthen their knee, and we need to work on that. We've had gout, which again is inflammation, certainly pain. Hands, because we normally put the conductors on the hands. We've got these sort of domes that you put your hands around. We've literally had people we had one client who wasn't able to close her hands, and by the one session, she's only ever had one session, she could close her hands, which was, and when I met her I think it was about 6-8 weeks later, she still could close her hands, which is phenomenal to me.
Yeah, no, that's really good. Yeah, when you were talking about, you can put, I can't remember what you call them, contact points.
Yeah, contact plates, yeah.
Contact plates. A couple of years ago, I tore a labrum in my shoulder. And I mean, I did everything to heal it as quickly as possible. I chose not to even consider the surgery route, because once you cut into the shoulder joint,
yeah,
it's unstable. Well, not unstable. It's a lot less stable than it will ever, you could never get it back to optimum once you cut through the capsule of the shoulder, because it loses its suction. So I thought, right, I'm just going to let it heal itself, and fingers crossed it would actually completely heal. And I was doing red light therapy, I was doing microelectrocurrent therapy, and obviously really working on optimizing my posture and doing specific exercises in the gym. And there were quite a few exercises I couldn't do because of the shoulder. I had to stop playing tennis for a whole year, which was extremely depressing for me. But it would have been quite interesting if, I could have used those beds and seen what the timescale would have been, because it took about 18 months to recover fully. I mean, it was kind of out of pain in about a year, but to get to the point where I felt confident to get back on the tennis court took about 18 months.
Yeah. It's interesting, because I suspect now, even if you use the bed and we plated it either side, I suspect you'd really still feel the tingles, and you may even notice an improvement from that. I mean, it's like with this bursitis, which I only got 2.5 weeks ago, I've got sort of pretty much the full range back. I mean, it was awful. I mean, I've got calcification that I triggered, and it literally just ruptured. And so I've got full range of movement back. I've still not completely got rid of the pain, but I think when I went and had an ultrasound, they said it would be at least 3 to 6 weeks at the stage I was at then. And I certainly within a week was able to move my arms, and during the day I don't really have any pain.
Thanks for watching this video, and don't forget to like and subscribe to the channel.